नमस्कार सबैजनालाई। आज हामी क्यान्सरको बारेमा डिस्कस गर्न गइरहेका छौँ। लेट अस स्टार्ट द टपिक ट्युमर or neoplasm. What is tumor? Tumor means uncontrolled cell division. Uncontrolled cell division is tumor. Meaning of tumor is uncontrolled cell division. Oncology. Study of tumor and its treatment is called oncology. Oncogene. Cancer that is tumor causing gene is called oncogene. Carcinogen, cancer causing agent like UV rays, X-rays, etc. Uncontrolled cell division is called tumor. Cancer causing gene is called oncogene. Study of tumor and its treatment is called oncology. Cancer causing agent is called carcinogen. Types of tumor. There are two types of tumor. One is benign tumor and another is malignant tumor. What is benign tumor? It is slow growing. However, malignant tumor is fast growing. Benign tumor is encapsulated. Not encapsulated. Benign tumor is encapsulated. However, malignant tumor is not encapsulated. Benign tumor is localized. However, malignant tumor is not localized. Do not spread. Benign tumor do not spread to other parts of the body. However, malignant tumor spreads to other parts of the body. Benign tumor in benign tumor, no metastasis. However, in malignant tumor there is metastasis. The spreading of tumor is malignant tumor is called metastasis. So we can use mnemonics to remember metastasis. M for metastasis, M for malignant, M for Martha. That is, benign is less dangerous. Malignant is more dangerous. Now, benign and malignant. Benign takes prefix oma. Malignant takes prefix carcinoma and sarcoma. Note: carcinomas, malignant tumor of epithelial origin. That is, malignant tumor of epithelium. Malignant tumor of epithelium is called carcinoma. Sarcoma, it is malignant tumor of connective tissue, that is mesodermal tissue, mesodermal tissue. Leukemia, also called blood cancer, is abnormally increase in WBC due to excessive formation in bone marrow. Malignant tumor of epithelial cell origin is called carcinomas. Malignant tumor of connective tissue, that is mesodermal tissue, sarcomas. malignant tumor of blood is leukemia, is also called blood cancer. Now, diagnosis of cancer. There are two types of diagnosis of cancer. The first one is histopathological test, also called biopsy. Tissue is examined. Tissue is examined from the suspected site. Imaging, CT scan, MRI, etc. CT. What is the full form of CT scan? Computed tomography. MRI. Magnetic resonance imaging. Confirmatory test of cancer is biopsy, that is histopathological test. Confirmatory test. Now, treatment of cancer. There are three major treatment of cancer. Surgery. This is the best method for malignant. Chemotherapy. There are two major drugs which are used for treatment of cancer, which are cisplatin and vincristine. Cisplatin and vincristine are the drugs used for the treatment of cancer. That is, these are the chemotherapy drugs for cancer. Radiotherapy, use of X-ray, gamma rays for destroying mass of tumor. Most common cancers. In old, the most common cancer among male is lung cancer. However, in Nepal, the most common cause of cancer in male is gastric cancer. Most common cause of cancer among female worldwide is breast cancer, while in Nepal, most common cancer among female is cervical cancer. The most common cancer among child is blood cancer. In worldwide as well as in Nepal, also called ALL, acute leukemic leukemia. Breast cancer is common in nulliparous. Cervical cancer common in multiparous. Screening test for cervical cancer. Is Pap smear test. Screening test for breast cancer, mammogram. Mammogram. Cervical cancer caused by HPV, human papilloma virus. Breast cancer is common in nulliparous. ओल्ड वाइडमा महिलाहरू बच्चा जन्माउँदैनन्. मोस्ट महिलाहरू एडभान्स भइसके, सो भएर बच्चा जन्माउँदैन. सो ब्रेस्ट क्यान्सर इज कमन इन ओल्ड वाइड फिमेल. हाउएभर इन नेपालमा बच्चा धेरै जन्मन्छन्, मल्टिप्यारस फिमेल हुन्छ. सो सर्भाइकल क्यान्सर इज कमन. स्क्रिनिङ टेस्ट फर सर्भाइकल क्यान्सर इज प्याप स्मियर टेस्ट. Screening test for breast cancer is mammogram, that is biopsy of breast tissue. Most common cancer among male, lung cancer. विश्वमा एयर पोल्युसन धेरै छ, सो लङ क्यान्सर। हाउएभर नेपालमा मेलहरू बाहिरको काम गर्नुपर्ने भएकोले खाना टाइममा खाना पाउँदैनन्, सो देयर इज ग्यास्ट्रिक क्यान्सर कमन। चाइल्डमा ब्लड क्यान्सर विश्वभरि पनि नेपालमा पनि एक्युट ल्युकेमिया। Treatment of cancer. There are 3 major treatment of cancer, which are surgery, chemotherapy, and radiotherapy. Best treatment of cancer is surgery. For chemotherapy, we use 2 major drugs, cisplatin and vincristine. Radiotherapy, we use X-ray, UV rays, gamma rays, etc. The best method of treatment for benign cancer is chemotherapy and radiotherapy, while that for malignant cancer is surgery. Diagnosis of cancer. There are 2 major diagnoses of cancer: histopathology, that is biopsy, and imaging. In histopathology, tissue is taken from suspected site and then it is examined. Imaging, we use CT scan, computed tomography, MRI, magnetic resonance imaging. Confirmatory test of it is biopsy. Carcinomas, malignant tumor of epithelial tissue, malignant tumor of epithelial cell origin. Carcinomas, malignant tumor of connective tissue, that is mesodermal cell origin. Leukemias, abnormal increase in WBC due to excess formation in bone marrow. Benign tumor is less dangerous. Malignant tumor is M for metastasis, M for malignant, M for marcha. Types of cancer, there are 2 types, benign and malignant. Yes. Tumor. What is the meaning of tumor? Uncontrolled cell division is called tumor. What is oncology? Study of tumor and its treatment is oncology. Oncogene. Tumor causing gene is called oncogene, and the cancer causing agent is called carcinogen. In this way, we have finished this.